Welcome to week 36. Today, there is so much to talk about, including baby development, the symptoms you may be feeling, what to expect at your next appointment, and be sure to watch until the end because I'm going to talk about the science of labor. You definitely don't want to miss that because, even though you do have a due date, in reality only about 4 to 5% of babies are actually born on their due date. Babies can come before, or they can come after, so it's important to know what to watch for and how to recognize those early signs of labor. But first, if you're new here, you're watching the Health and Medical Zone. And if you're new to the Health and Medical Zone, being here means being in good health and good spirit. So if you like being healthy and happy, go ahead and click subscribe, because you are definitely in the right place. At 36 weeks, you are officially starting your 9th and final month of pregnancy, and you have about 4 weeks to go until your due date. At this point, you can really start counting down because you are almost there. And that's a good thing, because these last few weeks can be a little more challenging. But you've got this, and always remember that I'm right here cheering you on. You may notice that you're feeling a little more tired, a little itchier, and you might even be doing the pregnancy waddle. But don't worry, you're on the last lap now, and your little one will be here very soon. By 36 weeks, your baby weighs around 6 pounds and is about 18 to 19 inches long. All of the organ systems are just about up and running, including the circulatory system, the immune system, and even the respiratory system, which is one of the last systems to fully develop and is now ready and gearing up for your baby's first breath. The digestive system is also ready to go, but it hasn't really started functioning yet since your baby has been getting all of their nutrition through the umbilical cord. It won't be fully developed until your baby is around 6 months old, when they'll be able to digest things more complex than just breast milk or formula. Now let's really talk about labor, because at this point, if you were to go into labor today, your OB is most likely not going to try to stop it. Your baby is ready, and there's a very good chance that your baby would go home with you when you leave the hospital. Not always, because your baby is still about a month early, but most babies do, which is really reassuring to know. Your baby would most likely be just fine at this point. As for you, hang in there. Use lotion for an itchy belly, elevate your legs or wear compression stockings if your ankles are swollen, and rest whenever you need to. You may also still be feeling that nesting instinct, which is that natural urge to clean and organize your home in preparation for bringing your baby home. If you're feeling that nesting energy and you feel well enough, it's okay to clean and organize, but be careful. Avoid lifting anything too heavy, take breaks as often as you need, and don't hesitate to ask for help when it comes to moving or lifting things like cribs, boxes, or anything else. By now, most OBs will want to start seeing you every week until you deliver. One important test your OB will likely do if it wasn't done last week is your Group B strep test. I talked about this in much more detail in the week 35 video, so if you missed that, be sure to go back and check it out. Group B strep is a very common type of bacteria. If you have it at the time of delivery, it can be passed on to your baby and potentially cause a serious infection. That's why, around 36 weeks, your OB will usually swab both your vagina and your rectum and send those samples to the lab to test for Group B strep. If the test comes back positive, it's very straightforward. You'll just receive 4 antibiotics before delivery. At your next appointment, your OB or midwife may also want to check your cervix. They're really just doing this to see where things are at, and there can be a lot of variation from person to person. So don't be concerned if they tell you your cervix is still closed and firm, and don't be surprised if they say your cervix has started to thin out or dilate a little. Both of those can be completely normal at this stage. If your cervix is slightly dilated this early, it does not mean that you're in labor. Being 1 or even 2 centimeters dilated at this point is totally fine and simply means your body is getting ready for delivery. Now, if your cervix were dilated to 6 centimeters, that would be a very different story, and you would most likely be headed to labor and delivery because you'd be in active labor. So now let's talk about some symptoms you might experience before labor actually starts, so you know what to expect. These are often called soft signs of labor. They're things you can watch for that let you know your body is preparing to have a baby, but they're not symptoms that need to send you straight to the hospital. If you notice any of these, you can simply take note of them and mention them to your doctor at your next appointment if you want. They don't mean labor will start in the next few hours, but they could mean that labor is getting closer. Number 1 is the mucus plug coming out. During pregnancy, your cervical mucus becomes thicker and increases in amount, and it collects at the cervix. This is thought to help protect your uterus and your baby by preventing bacteria from entering through the cervix. As you get closer to delivery, your cervix begins to thin and dilate slightly, which can cause that mucus to loosen and move into the vagina and then be discharged. You might notice thicker vaginal discharge, or you may even see the entire mucus plug come out. And again, if you notice this, it does not mean you need to rush to the hospital. It's simply a sign that your body is doing what it needs to do to get ready for your baby's arrival. Number 2 is the baby dropping, which is sometimes called lightning. This just means that your baby is moving lower into your pelvis and getting into position for birth. Before the baby drops, they often sit higher up, putting pressure under your ribs and against your lungs and stomach. Once your baby settles lower into the pelvis, it can relieve some of that pressure, making it easier to breathe. You may feel lighter in that upper area, which is likely where the term lightning comes from. There is a bit of a trade-off, though. While you may feel less pressure under your ribs, once your baby moves lower into the pelvis, you'll likely notice more pressure down below. You might feel increased pressure on your bladder, causing you to pee more often, or experience some discomfort in the vaginal or pelvic area. Number 3 is something called bloody show. As your cervix begins to thin and soften, small blood vessels on the cervix can break and bleed. Because of this, you may notice a small amount of blood-tinged mucus discharge, which is referred to as bloody show. This is completely normal during the last few weeks of pregnancy. However, if you notice heavy bleeding that looks like a period, that is not normal, and you should go to the hospital right away. Number 4 is an increase in Braxton Hicks contractions. We've talked a lot in previous videos about what Braxton Hicks contractions feel like compared to real labor contractions. As you get closer to your due date, you may notice that these Braxton Hicks contractions become more frequent and may even feel more uncomfortable. All of these soft signs of labor are indications that your body is progressing and preparing for delivery, but they don't usually mean that labor is about to begin. So now let's talk about the signs of early labor. As labor approaches, some women experience vague symptoms that might otherwise be brushed off as normal pregnancy discomforts. At this stage, though, it's important to pay attention to them. These symptoms can include mood swings, shivering, feeling restless, diarrhea, or cramping in the pelvis or lower back. You'll also want to watch for something called membrane rupture, which you may know as your water breaking. The sac that surrounds your baby inside the uterus is called the amniotic sac. When it breaks and your water comes out, you need to call your OB or go to the hospital. Your water can break before labor begins, but for most women, it breaks after labor has already started. You may feel a gush of fluid, or you may notice a steady trickle. Sometimes, it can be difficult to tell whether your water has broken or if you're leaking urine, since your baby puts a lot of pressure on your bladder. Accidents happen, and it's nothing to be embarrassed about. If you're ever unsure, call your OB. There's a simple test they can do to determine whether the fluid is amniotic fluid. Everything we've talked about so far is important to know, but the only true sign that labor has begun is regular labor contractions. So how can you tell the difference between true labor contractions and Braxton Hicks contractions? True labor contractions occur at regular intervals and usually last between 60 and 90 seconds. Over time, they become closer together and increase in strength and intensity. True labor contractions do not go away with changes in position. Whether you're walking or resting, they continue, and as they progress, it becomes harder to walk or talk through them. A good rule of thumb is this: if you're having regular, painful contractions every 10 minutes or less for more than an hour, call your OB or midwife. They can help you decide whether it's time to head to the hospital. Okay, mamas, the time is getting very close for you to hold your new babies. I'm honestly so excited for you, it truly is the best feeling ever. Next week, we have so much to talk about, including how many babies have moved into the head-down position, called the cephalic position, which is the preferred position as your body prepares for delivery. Thank you so much for watching.